What we are talking about builds on what has been discussed already throughout this week. And I just want to, the second slide is talking about us. We are from Kyambogo University in Uganda. And Kyambogo University has a total of 179 students with disabilities assessed and being supported. It is the largest number of students with disabilities in the universities, in the universities in the country. The second largest number is found at Makerere University. And the story is very simple, that Kyambogo University has a faculty that deals with issues of disability, and Makerere University, being the original single university in the country, had started services for persons with disabilities. They were training them there. But they find comfort in Kyambogo. We asked them why, and they said that. And they are found in all the faculties. The fewest number is in the Faculty of Science. The largest number is in the Faculty of Education and the Faculty of Special Needs and Rehabilitation. Why Faculty of Education? It is the misconception of the admissions board that most persons with disabilities do best in education, in guidance and counseling, in development studies, in psychology. Those are courses that were in the Faculty of Education. And I say misconception because we have challenged them to have 12 persons with special needs in engineering. And one of them who completed is now a very powerful solar engineer. I thought we should bring that background in the issue of admitting students with disabilities in higher education, because it is an inclusive environment. But why discuss disability policy? And why should we talk about policy anyway? The key issue is to promote respect for inherent dignity. You cannot promote respect when you don't have a guide that should help you to ensure full participation, to promote equal enjoyment of all human rights. And you people, you know your human rights. The right for survival, the right for education, the right for recreation, mention them. Those rights have to be captured somewhere. In fact, it is the policy that will lead to practice, good practice. And it is also because of the fundamental freedoms by all categories of persons with disabilities. We have to ensure that there is fundamental freedom. So, what about the framework? The legal frameworks are supposed to enhance equalization of opportunities for persons with disabilities to access the following things: to access justice. In fact, if there is no law, what will you use to go and argue for your right? Health. There must be a provision. And today we are talking about health for, the hospitals must provide accessibility for women with disabilities to reduce on maternal death. Employment. We have a quota which is in our laws, and that is the quota that we should use to push forward our advocacy, for us to network with others, and for us to promote our rights. Livelihood programs. I know that in every country in East Africa, there is a livelihood fund. This morning I was reading about Uganda, that livelihood fund is going to be scrapped because the government cannot provide for that fund. And somebody commented, it is not only in the Ministry of Gender where the livelihood fund is, but in all departments, they are going to reduce funding. But why start with ours? Rehabilitation. And we know the different forms of rehabilitation that we have. Our colleague, the journalist here yesterday, said he was from the health facility and came here. Those are part of the rehabilitation. But I was talking to some friends yesterday, and I said that when we are talking about rehabilitation, let us look at the CBR matrix, community-based rehabilitation matrix. That matrix gives us 7 strands for rehabilitation, and all those are necessary, and we are supposed to be aware about them. Public service, housing, and participation in recreation. So what are the categories of legal policy frameworks that we have? The first one is the national constitution. And I would like to take this very quickly because all of us are aware about it. The constitution is the key that we should always understand what is inside and where do we fall. The Persons with Disabilities Act. I know that all our countries have that. Let's study it deeper and understand it from the point of early identification to livelihood. The Equal Opportunity Act, the Human Rights Commission Act, the Land Act. I don't know in Tanzania because I know that you people are very good in taking care of your land. But the Land Act has a provision where persons with disabilities have rights to customary ownership, sharing the land. Rules of procedures in Parliament. Can you check if the rules of procedures in your Parliament have it? In Uganda, we have 5 members of Parliament. And one of the rules is to ensure that non-parliamentarians can attend Parliament. And those are the support personnel to persons with disabilities. They inherently become members of Parliament. They have the right to access the Parliament because of the persons they are helping. Communications Act. In fact, I would like to show you this letter. This letter was complaining about telecommunication companies not providing for persons without arms because they were not being accessible. And in our group discussion, in the disability group, somebody said, even banking institutions, they don't want to open for your account if you cannot have a fingerprint. The National Identification Authority could not register people and give them national identification cards if you don't have a fingerprint. As we talk now, today they were with the groups of the disability fraternity to see that that one is taken care of. So, these are some of the legal frameworks that we have. Employment Act, Road Traffic and Safety Act, Local Government Act. In Uganda, we have the Universities and Other Tertiary Institutions Act, Business, Vocational and Technical Education Act. We even have the Mental Health Act. And by the way, there is always a confusion between mental health and mental disability. We are the ones to advocate to make people appreciate those two differences. At regional level, we have the treaty that establishes East African Community. And I hope that you have picked keen interest to ensure that the needs of persons with disabilities are taken care of. We contributed information to this. Then we have the East African Policy on Persons with Disabilities. In fact, one of the things that I'm looking forward to is how we can use this forum to reinforce our existence and our recognition through these two treaties because of being in East Africa. And obviously the international one is the convention, which all of us are aware of. Who are the organs that are supposed to make laws and policies? By the way, you should not think about the national government only. We have the local governments. In Tanzania here, I think we have the districts, the district governments. Yes, they have bylaws and ordinances that can support us. Let us advocate with them. Let us lobby with them so that our needs, our rights, and provisions are taken care of. When we do that, they can be able to plan, they can be able to budget, they can be able to implement, and we participate in its evaluation, monitoring and evaluation. Ministries, departments, and agencies knock their door. They should have statutes. They should have policies. I'm going in a few minutes to give a case study of the examples. NGOs and CSOs. How do we do this? We must be exemplary. We must master the articles. I was so happy yesterday when I heard you people talking about the different laws. Master them and be able to use them. We must be aware of the bylaws which are within the community. And we must be aware of the affirmative action. When we are aware of those, let us use them. That one, I'd already done it. A case study. We have developed institutional disability policy. And 6 universities in Uganda have that. What are we doing? We have established a disability support center. I heard my colleague was trying to talk about the support center. A support center is very good because it's a one-stop center for services for students who come from the different faculties. And that is what is done. Then there must be a disability assessment. At every level, please allow people to assess and identify themselves, because you can only deal with people who are there. And then we do awareness raising. How can you do awareness raising? This morning, I read in our forum where there was a van passing around and making announcements for students to go and participate in blood donation. That is awareness raising at the peak. We have to train. When we are training people, we train them in skills, and we also train them in advocacy. But you must know, if you are deaf, you must know sign language, but there must also be an interpreter to be trained. And we must have human resource to coordinate our activities. Let us develop partnership with other support centers. Let us strengthen our outreach activities. I would like to see all the partners here reaching out to schools, reaching out to other organizations of persons with disabilities, reaching out to the ministries, reaching out to civil society organizations. And we can network on inclusive employment. One thing I would like to say is this, that if you don't have an OB in an institution, when you go for an interview, they will start asking, where did you study from? We have our OBs, and our OBs is persons with disabilities. When we are in a fora, we must advocate for their engagement. And we must advocate for accessible environment and strengthening outreach activities. What should be covered in the disability policy? We know all this, how to explain disability. And I'm happy that it was talked about there. You will be able to see this in the presentations that we are talking about. Affirmative action, accessibility, and recognition of the interest of persons with disabilities. I hope that with this discussion, you can be able to pick interest and know the law so that you use the law to help pave way for discussions about disability inclusion and for ensuring that our rights are taken care of. I thank you very much.